masa lagi, banyak orang makan Shiruto, banyak orang dapat kenikmatan dia. So, di sini saya ada seorang profesional. Dia adalah seorang jururawat profesional sejak 1992 dan kini sekarang dia beliau adalah seorang lecturer nursing dalam salah satu organisasi. So, beliau ada didiagnoskan dengan autoimmune arthritis sejak 2018. Okay, so di mana ini membuat beliau tidak dapat bergerak dengan cepat, dengan pantas sebab sakit sendi-sendi, sakit kita tahu aja arthritis tu semua sakit yang sendi-sendi semua kan. Dia punya lutut dia, kalau dia dah duduk dekat bawah, dia kena ada orang papah dia naik atas. Itulah dia punya kesakitan dia. So kini lepas all this macam-macam, Puan Sheela ni dia ada pakai Aulora Pants juga untuk melancarkan ke pengaliran darah. Dengan itu dia pun ada ambil Shiruto. Marilah kita dengar macam mana Shiruto dapat mengembalikan kesihatan badan itu. Okey, dipersilakan Puan Sheela. Ambassador Sheela.
Terima kasih Elizabeth. Salam sejahtera semua. Izinkan saya untuk membuat sharing saya dalam bahasa Inggeris ya. Okay. And let me just fill my slide. Elizabeth, are you able to view the...
Yes, can see. Okay, go ahead.
Yeah. Warm welcome to everyone. Thanks to our 3BE founders, are Lee Swetsen, Ms. Ho Hui Chen, Ms. Karen Leong, and my mentors are CCA T.Y. Low, CCA Angela Han, DCA Lilia T, and ECA Elizabeth Richard. Thank you so much everyone for your time. And okay, so earlier, thanks Elizabeth for the introduction. Now, all of you heard that I have this autoimmune arthritis. Okay, maybe some of you wouldn't have heard what is autoimmune. Now, autoimmune is something that happens when the body natural defense system can't tell the difference between the own cell and foreign cells, causing the body to mistakenly attack normal cells. So this is in a layman term understanding what is autoimmune. So there are many types of autoimmune. So what I have is autoimmune arthritis. And what are the symptoms of autoimmune arthritis? Yes, basically we have all the sakit-sakit sendi, and what I begin to have was also the swelling of the fingers especially, and it had a lot of restriction of movement. So it actually hindered me from doing a lot of things, activities, and as a nurse and also a lecturer, you sometimes have to go to the hospital. So me, carrying the patients and doing a lot of activities also was a problem for me. And the worst was the pain itself. So, but when when I go to sleep, the next morning when I get up, it's very painful. So literally, I cannot get up from bed. And there are days I actually feel very down. Why am I having this? And a lot of things that was actually going through my mind. And I was diagnosed with autoimmune arthritis in 2018. But it took for me 4 years before I decided, or actually, told to the doctor, yes, okay, I will take methotrexate. So what is methotrexate? Methotrexate is a medication to regulate your immune system. And it's actually the same medicine which they give for patients with cancer. And for me, it was all to regulate the immune system. And of course, there's a lot of side effect. And the main side effect for me was I even felt more lethargic, lagi penat, lagi letih. And I actually had to go on 3 months rest from work. And actually literally drained my energy. I wasn't able to do much. Although the dose was little, okay, but it really affected me a lot. And besides that, I had, for hair fall, my hair started to fall, and I was even feeling more, anxiety. I would say I was actually in the beginning of having some depression, and thinking how is it going to be for me in my career and all that. So that's when I was introduced to. Okay, I was introduced to Aulora Pants. I met Elizabeth and Angela Han. I still remember the day when we met at Coffee Bean in Bukit Jalil. Actually, the initial meeting agenda was something different, but I was introduced to this. And yes, thank you so much. And Aulora Pants, that was the first product which I used because of my knee pain. I actually wore that and really helped me a lot. And then subsequently, towards the end of the first month itself, after I achieved ambassador, I actually, invested. I would say rather than buy, the correct word would be invest, because health is actually an investment. So I invested in Shiruto, and I actually bought 16 boxes. All right, of course, 60 buy 16 3 free. And yes, until now, I'm taking 2 sachets per day. And as a nurse and a lecturer, you still need to go to the hospital. And at that time of COVID, I was still out in the hospital, need to supervise students. We also worked in the vaccination center. So with me taking methotrexate, what methotrexate can do is actually make the person to get other infection easily. And actually, I had fungal infection as well, and that was another, upsetting thing. But that time, I wasn't taking Shiruto, and actually it healed, but I was taking medication. So until today, I'm taking Shiruto 2 sachets per day, and really helpful. And and I would like to share with you that after wearing the pants, hold on, there's something wrong with this. There's okay, all right. After about 10 days, this is 1 month and 3 days. You can see the difference. I actually lost weight, but you also can see the water retention that developed from the medication. It was reduced a lot, and my face was puffy here, and you can see there's a lot of difference. And the tummy, and here is I lost about 6 kg, and yes, the size of the hip and the waist actually reduced by 6 centimeter. So that was a good news. So with that, it really gave me a sort of some happiness for me to look forward to certain things in life. And yes, this was my hair fall. It was quite bad initially 3 months ago. And yes, you can see, just take the picture today, and you can see the difference. Slowly but surely, I'm sure. Alright, so this is another effect that I saw from taking Shiruto. And of course, with the Aulora Pants, the circulation improved much better. And actually, even some of them saying your skin complexion looks better than before you were actually on medication. So I'm still taking methotrexate on medication, but very low dose. The doctor said that my the level of inflammation in the body has reduced, and it's actually in the normal. So I'm still taking very small dose of methotrexate, plus I'm supplementing with Shiruto, and hopefully in the next appointment with the doctor, I can stop the medication. So I will continue Shiruto as so-called my immunity partner, all right? And yes, thank you so much, and that's all for my sharing.
Okay, that was a great sharing, Sheela. I'm so happy to hear that you have reduced your dosage of medication. So now, when you do a lot of your, earlier you had this arthritis, right? So how about when you squat down to wake up, do you feel more tired, or it's easy to do it by yourself?
It's much more easy in